Good morning, good afternoon, and good evening from wherever you are. So this is a short discussion we're going to have today to just talk about public health opportunities in the United Kingdom. So my name is Carlo Udu. I'm a medical doctor and I work as a clinical fellow in public health in NHS Forth Valley, Stirling, Scotland. So I want to thank Zeri Bemus Foundation for the opportunity to use this platform to talk to colleagues and anyone who will be listening to this discussion later on. Okay, so we're going to be talking about the opportunities in public health in the UK. Most people have this notion that it's not possible to come from outside the UK or from outside the EU and have the opportunity to work in the public health system. Well, you could say it's to some extent is the reality, because public health opportunities is actually open to virtually everybody in the UK. So you could come from medical or non-medical background to become a specialist or a practitioner in public health. So it makes it quite difficult for people from outside the EU and the UK to have the opportunity to participate or to practice public health, despite the various levels of degrees they have acquired, maybe masters in public health or even PhD in population health or public health related discipline. So, but today we're going to be talking about a few things that can help us to be able to get into public health space in the UK. You can actually do that, maybe get a job from Nigeria and move over to the UK. So the first thing I'm going to talk about is what we call the shortage occupation list. So I'm going to be sharing my screen just to show us what I mean. Okay, so in the UK, there are various ways people can enter into the system. And one of them is actually going to the UK through the visa route we call skilled worker visa. You can enter into the UK using the student visa. You can also enter through another visa we call independent visa. There's a tier 4 visa for students and some other workers can use that. So there's a tier 2, which could be for skilled workers and other people. So there are other visas, but we are going to concentrate on the skilled worker visa. So what does it mean to pass through these routes? It means that the kind of work you're going to be doing it's quite a skilled or technical kind of job. It's not just a menial job. So you're coming in to bring in your skills, maybe you're a health professional, you're a physician, you're a psychologist, whatever it is. So in the shortage occupation lists, what you need to know about is that there are few jobs or few occupations that is considered as in short supply, to be in short supply in the UK. So that's what they term the shortage occupation list. And what that means is that because they are not able to fill those positions from within the UK or from the EU, they can actually get in more people from other places. So these are the lists. I will suppose you're saying it. So, but if you look at the first one, you will see it is health services and public health managers and directors. So, and it's all jobs that relate to public health managers. Where are the places that you can work if you're working at the level of this public health managers? You can work in England, Scotland, can work in Wales, Northern Ireland. That means all the 4 nations in the United Kingdom, you can actually work from there. So it also means that you can be given the certificate of sponsorship. The company or the agency or the institution you're going to be working with can sponsor you to come over with a visa to work. So there are other ones there, but because we are focusing on public health, I will not take my time to talk about other ones. But there's also something else I want to show us, in case you're health related, even if it's not public health. They said something here that shortage of occupations for some jobs if you're in the healthcare or education. So I'm going to open this to show us the specific jobs apart from public health. Of course, medical professionals or medical practitioners like doctors, all jobs relating to medical profession. I mean, for doctors, you could work in any part of the UK. Psychologists, pharmacists. So pharmacists now, in case you're a pharmacist and you're in the group or you're in this meeting, it's also possible for you to come over. It didn't used to be like that before, but things are opening up. So you could also see health professionals not elsewhere classified, meaning that any other people or any other group of health professionals that you couldn't see under doctors or other places like pharmacists, they can also work in the UK at the moment. You see nurses, everybody, all jobs in nursing can fit into that. Then you could also see social workers, all jobs. Social workers care about the welfare of the people. There are care homes, there are old people's home. There are a lot of things that they do in social service. So if you have a background in social service, it means that if you have the plan to move over to the United Kingdom, it's possible. So it says all jobs in social service, so you could take advantage of that. Even paramedics, it said all jobs. Then nursing auxiliaries and assistants. So you could see that care workers, care assistants, and many of all those jobs that people could work in the UK that was not possible before, they have come under the shortage occupation list. So meaning that you have an opportunity now to seek a job or seek a career in the UK if you fall under these job rules here. So I will now move on to something else, which is the public health we're going to be talking about. So you want to work as a public health person or personnel in the United Kingdom, you should realize that there are certain things you need to do really to qualify to work in the UK, because in the United Kingdom, people with highly skilled or information, people who have trained to great levels are already working in the UK and are seeking to work in the UK. So it means that if you want to compete favorably, you should have the relevant experience and you should also have the relevant educational qualification. So most of the jobs that will come under the public health manager role, you should at your level had population health experience, maybe within the UK or outside the UK. And usually a Master of Public Health would be needed. So if you're hoping to move in the public health space, you need at least a master's, not necessarily MPH, but master's that is relating to population health will really give you an advantage. And because they listed public health manager here, it doesn't necessarily mean that it's that easy for people to get into if you have not done what you're supposed to do. You could see people who have all through their life, they have 10 years, 15 years public health experience, and you are going to be competing with them. So what are you going to do? first of all, you need to start ahead of time to prepare yourself by maybe volunteering in public health space in whichever country you are. Start working in things relating to population health. And if you've completed your undergraduate studies, it's also a good thing to seek for an opportunity to pursue a master's degree in public health or population health related courses, because that would help you. So how can I search for an opportunity in public health in the United Kingdom? I'm going to take us to the NHS website. So this is the NHS website. There's actually NHS England and Wales. That's what you find in NHS websites here. There's also NHS Job Scotland website. So the website I am now, it's NHS England and Wales. So I'll just go back again. So I started with typing NHS Jobs. So when you get to NHS Job, it will bring out a few links for you to click on. But the one I'm usually interested in is this NHS Job, which is www.jobs.nhs.uk. So if you click on this, it takes you to this beautiful page. You can cite the various jobs. There are like 30,775 live jobs now in NHS. NHS means National Health Service. So it's more like their national, the national form of healthcare that takes care of the health system, the national health system in the UK. So if you click on this, you would see where it can ask you to type your keywords or job reference. So usually what you can do is to come down here to look at the advanced search. If you click on this advanced search, it will give you an opportunity to put in more filters to lead you to where you want, because you see, you may not be able to look up over 30,000 jobs at a time. So what would I do, or what can you do? You can come to this place, they are asking for keywords. Type in public health. As you're typing in, it will show up. So you just click on it. If you have any particular location you're interested in, you can just put it. But usually, there's no point putting it if you're coming from outside the UK, except if you have any specification. If you want any salary range, you can put it. You can also put in additional filters. Usually, if your job is to land the public health manager level job or public health specialist job, it's from a band 6 or band 7 and above. So I'll just click all of them. Then, so other pay band, so for doctors, if you're interested, you can click specialty doctor, foundation doctor, registrar and all that. But if you're not a doctor, it doesn't matter really. You can go as far as coming to this staff group. You want to, if you want them to include allied health professionals, things that will relate to public health, healthcare scientists, medical and dental, that's where doctors will come in, nursing and midwifery. If you're a nurse and you want to venture into public health jobs, you just go there and click it. Then the job type, you might want a permanent job, but I'll click fixed. Fixed term job could be a 1-year job or 2 years, after which there might be an opportunity to renew. Permanent job has a different pathway or a different terms and condition. So you could look at the working pattern you want, maybe full-time. If you're coming from abroad, it has to be full-time because Part-time may not give you the necessary points you need to get a visa. So after going through all this, I'll just click search. It will run the search for me. And I have 17 jobs here. If I remove some other ones, some of those things I clicked on, it will give me more jobs. So, but you could see that you have a public health nurse here. You have lifestyle public health nutrition stroke dietitian lead. You have pharmacy program facilitator and specialist homeless health visitor, early years midwife, specialist homeless. So you could search through all this and we can find the one that will interest you. You might even refine this search if you have searched and you think that you don't have enough rows here. I can refine the search. It will take me back to where I came from. I would click on check this and I just wanted to give me a general search for public health. Maybe that would help me make more choice. Okay, so I'm going to search. Let's see how many it gives us. It gives us a whooping 1,117 jobs. So you could see senior public health manager here. You could see specialist community public health nurse, and there are a lot of other things, principal public health practitioner. All these ones, if for instance, you check this one, you open this one, it will take you to the job specifications, all the things you need, and you can apply for it if you match the person specification or you have all the criteria that they want. So, and that's the same thing with public health, NHS Scotland. This one is NHS Scotland. How did I go there? You go there, show this way, just a moment. Okay, so you can start with, okay, so I'll just NHS Scotland Jobs. It will open just like it did for the NHS, the other NHS website. So this is the one that we want, NHS Scotland Jobs / job train. If you open it, it goes to give you this page. You can look at live vacancies. So there are fewer jobs here, unlike the other NHS website we checked. So you have you have 1,765, that's 1,765 jobs available. You can also search with key points. I already have been putting in public health, so you will see it here. So if I search, it's giving me 40 jobs here. So the same way you go through anyone that's it's like what you want to apply and it's at the level of the public health manager role, you can click on it and follow their prompts to make your application. So the last one I will talk about is an app that's a public health app. I didn't open it actually, but you can download it from Play Store. It's called Adzuna. It's ADZUNA. So if you download that on your system, on your phone, you can set it, the location to be the UK, and you punch in public health to search for you. It will always give you over 4,000 or close to that public health jobs, all in UK. So your duty is to now search and search and search the one that applies to you. You would use that to make your application and hoping that you get it. So thank you very much for listening. I would now yield the floor to everyone for question and answers. So if you have any question, this is your time to ask. Thank you very much.
So yeah, a really fantastic presentation and very straight to the point. One question, or a couple of questions that I have. Number one is, are these jobs still active, or put in another way, how efficient are they with updating their website so that once a job is taken out of the web page, less people don't go applying for something that doesn't necessarily exist?
Okay, so it's real time actually. If they will even specify the time the deadline is, not just in date, but also in an hour and in minutes. For instance, if a job, I can actually go to one of the jobs or something and just do a check. So what I was trying to say is that you could check, for instance, if we're looking at this public health lead, health protection, it's saying it's posted on this date and would be the 17th of May would be the deadline. So, but if we open it, okay, so let me go ahead and open it just to show.
Yes, I get an insight into what you mean now. For example, they normally tell you that your deadline is, let's say, 11:59 p.m., something like that.
Exactly. So that's, and at 11:59, it closes. The system would put it out, so you won't have the opportunity to apply again.
To submit again.
Yes. So just to say that it's updated.
Yeah, that is very important because, we have 4,000 plus jobs, but you want to make sure that these are really jobs that people can access, and that they can still be considered for. Yes. Right. The other question I wanted to ask is, I saw a place when you were in the beginning, when you were showing all the options that exist. I think it was for skilled worker visa, right? On that page, there was something like 80% of working rate, something like that. So what actually was referring to, is that you paid 80% less than national average for the job, or what?
Yeah, so there are specifications.
I guess that was the page before you came to this one.
Okay, so I would, the going rates. Okay, that would mean this. Okay, so even though that you're expected to apply, but it also means that the amount of money you are going to be receiving would be equal to what they have noted in this place, specific to that job. For instance, now, it's possible that the same health services and public health manager job can go below these amounts. So if you're coming from abroad and your salary is not up to this, you won't be given a COS.
I see. So you have to be paid a certain minimum amount of money.
Yes.
For you to have a chance. All right, I see.
Yes.
And I think it's a good way to avoid people taking advantage of people from outside by paying them cheaper.
Yes.
I see. I get the point. Okay. Do you know whether these positions also either support people to go to school, for example, provide some sort of study leave and funding support, or at least when you want to go for studies, and that they don't stand in your way?
Okay, so each whatever that's taking you to the UK would have a visa route for you to enter into the UK. So if you're entering into the UK as a skilled worker, the kind of visa you receive is the health and care worker visa, or formerly known as Tier 2 visa. Actually, health and care worker visa is under Tier 2 visa. So it's tied to the organization that is hiring you. And if your time of work is 40 hours, you must have to spend it with them. So you won't begin to think of any other thing. And since it's a full-time, it means that 9 to 5 almost every day, except if you have a different work pattern or work shifts before you can do that. However, if maybe you're on a tier 2 visa and you have someone that is your dependent, because a tier 2 visa can have a dependent, maybe your wife, your children who joined you. So they are free to study or do anything, but for you yourself, you might not have that liberty, except if part of the role you're playing or part of your job requirement is that they will train you or give you some form of capacity building. So they will build it into your timing. Some jobs can be 50% in the office and 50% maybe some form of professional development, educational, some more educational pursuit or anything. So, but if it is not stated in your visa and in the role with which you're coming in, it may be difficult.
That's interesting. Yeah. Also, let's leave the floor open for people to ask questions.
Okay, let me just ask one question, please.
Okay.
Can you hear me?
Yes, I can hear you clearly.
Okay, thank you, Carlo, for that presentation. My question is as regard, I know you opened a website about skilled worker jobs and under the point-based immigration system. So I was like, do you have any experience on the success of people that are not nurses or medical doctors following this route from outside the UK getting these jobs?
Yes, so I would say yes, but the thing there is that it's not, nothing good comes easy. It's not an easy route, even though it's been opened. And that goes to the allusion I made earlier, that because a lot of experienced workers or job seekers who want to come to the UK, it might be difficult for maybe someone coming from a low and middle income country who does not have vast number of experience getting the job. But I can count up to 1 or 2 or more persons who I relate with even in our place of worship, and they are senior care workers. They are not doctors, they are not nurses, but they were sponsored to come over. So it's a possibility. Even for, let me just go digress a bit, even for doctors and other professionals, maybe lab scientists and all that, if you even want to work in the public health space through your own route, you will still have to take the necessary exams that are professionally required from you. For instance, although I work in the public health space at the moment, I couldn't have come in if I was not GMC registered, more like if the UK body governing the practice of doctors did not register me. So I'm registered and licensed to practice as a doctor in the UK. So, but I am working in the public health sector. So the kind of thing I do is still public health related, but more like in the capacity of a doctor who is in public health. So also, if you're a nurse, a lab scientist, or any other profession, and you want to pass through that route, you would still have to take your exam. But UK can also, I mentioned earlier that in UK, you can work in the public health space, even if you don't have any health background from your undergrad. So you can work as a communicator, you can work as, I don't know, but a lot of examples are out there for people to work in the public health too.
Yeah, I understand. In the UK, once you've got a degree, you can work anywhere, provided you can bring the transferable skill.
Yeah.
Yeah, that is a good thing.
Okay.
Thank you for that.
Thank you, sir.
Yes, I was just going to say that the point you made regarding people having to register with their professional body first before still being eligible for this program, perhaps actually explains why we had this problem we had recently with the scientist training program, Chief Upai, that we were discussing on Telegram. It seems that people would have to still do that registration. For example, the medical lab scientists would have to register as biomedical scientists with the Health and Care Professions Council. So it looks like that process cannot be circumvented by any other of these other programs. That's what you're suggesting. Is that correct?
That's a possibility. I wouldn't know for that one, but yes, I've had, there was this opportunity that came out 2 months ago or thereabout that required people, it was an epidemiology training, but it also required that each of those professionals, if you're coming from the doctor's route, you should essentially have a GMC registration. If you're from the dental route, General Dental Council, medical lab, veterinary, whichever profession you're coming from, if you're a nurse, the Nursing and Midwifery Council should have endorsed you that you're one of them and all that. So it's a possibility.
Zerube, concerning the scientist training program, registering with SCPC is not a criteria because the program itself is designed in such a way that you are on the job training for a master's program which lasts 3 years. At the end, you qualify to register with SCPC as a clinical scientist.
Oh, I see. So it's actually a completely different path then.
Yes, it's a different path, yeah.
Okay, so the very important thing that people would need to know is whichever job application you're going to put in your application, you should try hard to look at the person specification and every other thing, essential criteria and desired criteria, so that if you're able to meet up with the essential criteria, then the possibility of being shortlisted might be there. But you would see that some persons will just apply whether they meet up or they don't meet up. And most times, even when you meet up with the primary essential, let me just say primary essential criteria, it's possible that the people you are competing with have vast experience and they might now raise the bar again and take the best from the best, even though you have qualified based on the eligibility criteria that was published. So Emmanuel, you are around now. Do you want to ask your question?
While Emmanuel is waiting, I'll just chip in something from what you've said already. If you're applying, one key thing we always advise people is this: get hold of someone who is already working in the UK to preview your application before submission. Because from what Carlo has mentioned, the person specification, job description, the employer wants you to write a statement indicating how you met each of those requirements they've listed. So you don't just have to go and write this vague composition or vague essay, thinking, okay, the person reviewing it have to go and look for them. You have to specify directly, how you met those requirements, which is very, very important, because if they can't find it straightforward, then they can't progress your application.
Okay, thank you, Dr. Upai. All right, Arinze, are you available to talk now? You're still up your hand.
Hello.
Yes, go ahead.
Okay. Hello, can you hear me now?
Yes, you're audible.
That's Emmanuel.
Okay, Emmanuel, go ahead.
Okay. Okay, thank you very much for the presentation. with what you said that they will need you register with your professional body in UK, and if you're applying outside UK, then how do you go about it? By getting registered with a professional body when you are not there? Is there any opportunity to write that exam outside UK? Thank you very much.
Okay, thank you very much, Emmanuel. I would say that it's not every job that will require you to register with your professional body, not every public health job. So, but you would have the relevant experience, and if you're gunning for a position as high as public health manager or specialist, you should at least have a master's in public health or something close to that in population health, master's in population health related field. Having said that, to answer your question, if you want to register with your licensing body or professional body, you would have to look up their requirements on their website, because most will have all it takes for you to register. For instance, you may need to take some exam, like if you're coming from outside English-speaking country, they may require that you take IELTS or any other English language exam to justify that you can speak their language. Then there may be other steps of exam. For doctors, you might have to take PLAB 1 and PLAB 2. PLAB 1 is done in your country or any other country that is not in the UK. It's also done in the UK, but PLAB 2, as we speak now, is only done in the UK. So it means that you have to travel, get a visa, and do all you need to do to come over to the UK to write it and pass it. So it's only when you have passed the relevant exams that you can now be qualified to be registered. So if you've passed your PLAB 1 and 2, I'm speaking from the doctor's angle. If you've passed your PLAB 1 and PLAB 2, you register with the General Medical Council to become a licensed and to be registered and licensed to practice in the UK. So otherwise, you're not eligible to practice as a doctor, even if you've qualified elsewhere as a doctor. You have your MBBS or what equivalent qualification for doctors. But for you to be registered and to practice in the UK, you would have to follow their steps. So if you're whatever discipline you are, you need to look up what they need you to do in the UK for you to get that. Some will require you to come over to the UK. The last one I would say is for nurses. I also know about that one. So you need to write your CBT after having written your English test. That's your IELTS. You now write your CBT. You can do it in your country, but the OSCE is mainly done in the UK. I don't know whether they have any other OSCE site outside the UK, but I'm sure it's done in the UK, in so many parts of the UK. So it's when you now pass that one, you'll be registered with the Nursing and Midwifery Council. All right. I hope that was useful to you, Emmanuel. That will probably be the last one before we wrap it up. I would conclude now and say thank you for joining in this discussion. I hope we find it useful. If you require further discussion or further support, you can contact me personally and we can move from there. Thank you very much.